Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we'll talk about a prescription medication called Carvedilol, also known as Coreg, that has been on the market for nearly 3 decades. This medication was initially approved for the treatment of heart failure and hypertension. Since then, it has broadened to include various cardiovascular conditions, including reducing the risk of death from heart-related issues following a heart attack, and is also considered first-choice medication for heart failure. Aside from its approved uses by the FDA, this medication can also be prescribed for off-label use for conditions such as atrial fibrillation and angina or chest pain. Now let's discuss how this medication works. Carvedilol belongs to a drug class of medications known as a non-selective beta blocker. It works by targeting specific receptors in your body to help with heart function. Carvedilol's mechanism of action involves blocking certain receptors known as beta-1, beta-2, and alpha-1 receptors, and it also has antioxidant and anti-inflammatory effects. First, Carvedilol blocks beta-1 receptors, which are primarily located in your heart. These receptors, when activated, signal your heart to beat faster and harder, leading to an increased heart rate and higher blood pressure. By blocking these receptors, Carvedilol slows down your heart rate and reduces blood pressure, easing the workload on your heart. Second, Carvedilol also blocks beta-2 receptors, which are not only present in your heart but also regulate other functions such as the widening or narrowing of your blood vessels and airways. By blocking these receptors, Carvedilol slows your heart rate. However, it is important to keep in mind that blocking beta-2 receptors can also cause airway constriction, potentially worsening symptoms in those with lung conditions such as asthma. Carvedilol also blocks alpha-1 receptors, which are responsible for tightening blood vessels and increasing heart rate. By blocking these receptors, Carvedilol further slows your heart rate and relaxes blood vessels, thereby lowering blood pressure. This medication also has antioxidant and anti-inflammatory effects. Oxidative stress and inflammation are known contributors to heart-related issues. By reducing inflammation and increasing antioxidants, Carvedilol may provide additional benefits for heart conditions. Keep in mind that it may take approximately 1 to 2 weeks for the complete blood pressure lowering effects of Carvedilol to become noticeable. Let's move on to dosing and administration. Carvedilol is available as both an immediate release and extended release tablet with strengths of 3.125, 6.25, 12.5, and 25 milligrams. This medication can be taken by mouth with food to decrease your chances of experiencing a drop in blood pressure when switching from sitting or lying down to standing. If you happen to miss a dose of Carvedilol, take it as soon as you remember. Avoid taking 2 doses of this medication at the same time to compensate for any missed doses. Keep in mind that it's not recommended to discontinue Carvedilol or change your dosage without speaking with your doctor first, as doing so could potentially cause chest pain or precipitate a heart attack. Unlike all medications, Carvedilol has a few side effects, which may include dizziness, weakness, dry eyes, fatigue, diarrhea, or orthostatic hypotension, which is described as experiencing a drop in blood pressure when you stand up from sitting or lying down, or insomnia or weight gain. If you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. It is also possible for Carvedilol to cause serious side effects in some. It is important to be aware of these potential risks and to receive medical attention immediately if any serious side effects occur, including heart failure, including having trouble breathing, rapid weight gain, extreme fatigue, chest pain, and swelling in the legs, ankles, or feet. Bronchospasm, including having symptoms such as tightness in your chest, difficulty catching your breath, wheezing, coughing, dizziness, and extreme tiredness. Worsening chest pain and heart attacks. Slow heart rate and low blood pressure, potentially causing symptoms like dizziness and fainting. Masking symptoms of low blood sugar, making it difficult to recognize and treat. This medication can cause your lung vessels to narrow, which may exacerbate breathing difficulties, especially in those with asthma or COPD. Masking signs of hyperthyroidism, like a rapid heart rate. Intraoperative floppy iris syndrome, also known as IFIS. In rare cases, this medication may cause changes to your iris, which can complicate cataract eye surgery. That's why it is important to inform your doctor if you're taking this medication and planning to undergo this surgery. Carvedilol has the potential to interact with numerous medications, including antiarrhythmic medications such as amiodarone or digoxin, antibiotics such as rifampin, and calcium channel blockers such as verapamil and diltiazem. Before starting treatment, make sure to inform your healthcare provider about all medications. Avoid starting any new medications while taking Carvedilol without consulting with your provider or pharmacist first, as they will assess the safety of all medications for you. To briefly summarize what we discussed today, Carvedilol, also known as Coreg, is a prescription medication with nearly 3 decades on the market. Initially approved for heart failure and hypertension, it now covers various cardiovascular conditions, even reducing the risk of death after a heart attack and being a go-to for heart failure. And along its FDA-approved uses, it is sometimes prescribed off-label for atrial fibrillation or angina. Carvedilol, a non-selective beta blocker, acts by blocking beta-1, beta-2, and alpha-1 receptors while also offering antioxidant and anti-inflammatory effects. By slowing the heart rate and relaxing blood vessels, it reduces blood pressure and eases heart workload. Dosing-wise, it's available in immediate or extended release tablets best taken with food. If a dose is missed, it is recommended to take it when remembered but never double up. Don't change doses or stop without consulting with your doctor. Some side effects may include dizziness, weakness, or orthostatic hypotension. Serious ones include heart failure symptoms, bronchospasm, or masking low blood sugar. This medication may interact with other medications, so always inform your doctor of your full medication list. You can read more about heart failure, hypertension, and other heart conditions on our website, so check those articles out in the links below. And if you have any questions about Carvedilol or beta blockers, be sure to ask your healthcare provider or leave them in the comments below. And don't forget to subscribe. Bye for now.